Our next speaker is Dr. Aine Abbott. Aine worked as a GP until 2012 and has since worked as a Macmillan GP facilitator and also as a speciality doctor in palliative care. But today Aine's coming to talk about a project called the Patient Passport. I had never seen the Patient Passport actually in the flesh until today, and it looks absolutely fantastic. Without any further ado, I'll introduce Aine. Thank you very much.
I guess I'm going to talk about the whole area of self-management, which is, I guess, pertinent for anybody who's living with a medical condition, but particularly pertinent for anyone who has a rare medical condition, because I guess there's a lot of work involved in having any kind of a medical condition, and anyone who has to adapt with the day-to-day changes involved in a changing health status understands that there are complex interactions and there's complex communication tasks in terms of explaining individual unique needs and individual unique requirements, and having some idea about what's ahead on a week-to-week basis, and being able to anticipate that and being able to share that information with all the people around you who are most important in supporting your care. So while this project to build this tool began as a very clinical tool, which is very important, a bit like the tool that Shane's described, which is very important, it over a prolonged period of conversation, it evolved towards being a tool which is aimed at people who are living with medical conditions, and the information contained within this tool is aimed at individuals who are living with medical conditions and those who support them. A lot of words on here. This is the consultation document on the UK Plan for Rare Diseases in 2012 talked about a person-held tool and talked about what a person-held tool might be able to achieve in terms of promoting choice and control, in terms of coordinating care, in terms of providing key information, individualised, customised information, and supporting self-care, facilitating joined-up working, and kind of getting the idea of an evolving collaborative care plan. I think all of us are a wee bit, we're kind of a little bit sceptical about the idea of care plans. They're very good, but life doesn't always follow plans. Life tends to be unpredictable. So this aims to be a template for a very individualised and evolving and changing care plan that changes over time and that is collaborative. So it's a person-held tool. This is one of them. It's a paper version at this stage, but I have been chatting to some of Shane's colleagues about providing an electronic version of this, and it's at an embryonic stage, but hopefully it's somewhere we'll get to. It provides a template for anybody who wants to carry around all the essential information that they and their carers need to know about their condition as it evolves. So the information within it changes as the condition evolves. It's collaborative. As I said up here, the boundaries of self, we talk about self-management, but in fact, for any one of us, when we're living with a medical condition, there are lots of people who are potentially involved in our day-to-day support. That might be family, it might be carers, it might be care workers. For anyone who loses capacity and who is no longer able to communicate for themselves, for example, there might be a whole lot of people who have more of a day-to-day role in keeping this updated and managing this than the individual themselves, but primarily it belongs to the individual, and whoever they decide is allowed to have access to it. This is a little bit about the history. It originated back in 2011 when Dr. Jenny Jingles from the Public Health Agency and Professor Scott Brown from the RCGP got together to talk about the idea of what originated, in fact, from the end-of-life care strategy as an end-of-life care passport. It rapidly moved away from that once we started talking and listening to these groups of people. There was a steering group set up under the chairmanship of Professor Max Watson, and over 2 years there was a very large conversation that happened with all of these groups and lots of individuals who are living with medical conditions. This emerged very, very gradually. We had lots of versions that went out and came back and were changed, and went out and came back and were changed, and eventually we sent out a pilot version, which we had 350 of, and some people are still living and working with those. We have a couple of very key contributors here in the person of Michael and also Michaela, who and a lot of other familiar faces in the room who had a big input into this, and we're hugely grateful for that. because really, I think as professionals we realised that we had a heck of a lot of learning to do in terms of the day-to-day challenges of living with long-term medical conditions. So it's about spiral communication, really, and I suppose that's one of the challenges that anyone faces when they're living with a medical condition, is that while things evolve and change, every time things change, you have to keep everybody in the loop. So there's this constant spiral of going out and saying, now, you know, if this happens, that you have to contact this person, and you know, and it's keeping all the different people who need to be up to date as far as is possible. The content, I'm not going to go into a lot of detail because we don't have a lot of time, but there are some person-centred information about the individual themselves, about what they need practical help with. There's some information that comes from the GP. There's some information about previous medical history, about medication. There's some space for pharmacists and others to write specific advice about medication. There's some space for information prescriptions or specific medical plans or emergency care plans in the event of specific things happening, information about who's who in the healthcare team, about support teams, about community and voluntary resources, specific information about medical conditions, particularly those which are rare, that can be carried around and given to healthcare teams who could say, I've never heard of that before, and you could say, well, here you go. And then there are the potentially difficult and sensitive area of advanced care plans, which some people may want to complete and others may not. Next steps, we're at the slow stage of implementation, and we do think this needs to be slow because we still have a lot to learn. We need to continually evaluate this and update it and change it. We need electronic versions. We're very happy that the Children and Young People's Strategic Partnership are in many ways way ahead of us in this. This is an adult version of this tool, but Bernardo's have been piloting these tools for quite a number of years in the region, and the Children and Young People's Strategic Partnership are now developing hopefully a version of this which will be compatible with this, so that people can have one throughout life. You can get more information from this very long website address, which is really the rcgp.org.uk, and then I think you can probably find it from there. There's a short film starring Mr. Michael Holden and others, which explains what the tool is about. There's a report and there's a PDF version of it. Also just like to thank the Creative Technology Department at the University of Ulster, who helped greatly with the artwork, and particularly Emma Heddles, who did the logo for us. And that's it. Thanks.